Hi, my name is Lindsay Chambers. I am addressing the refugee population, environmental, and cultural factors. Health concerns associated with the refugee population are economic stability, healthcare access, education, as well as social and community factors. Recent media stories in the United States express concerns about the crimes from Afghan refugees who are temporarily staying on U.S. military bases. Most of other media is discussing the increased number of refugees due to the increasing violence, political unrest, and even climate changes. Conditions are dire for the millions of displaced people, and the media is asking for help. Family support is vital for refugees. Families or other refugees from the same country will have many of the same feelings of loss and cultural and language similarities. It is important to provide refugees resources to communicate with family members left behind from their homelands. Studies show families are the most often the first to recognize if an individual is struggling or needing additional help. Families can provide support needed to prevent the need for mental health interventions. Millions of children have been born as refugees or spent most of their lives as a refugee. For children and adolescents, peers play a large role in their lives, which can be both a positive or a negative influence. Adults need friends they can relate to as well. Being surrounded by other refugees can provide a safe environment to continue their cultural traditions. Utah has programs specific for youth refugees such as girls' volleyball camp, youth educational conferences, and youth summer internship programs. Once refugees are relocated, they should not have a need to seek refuge again. It should not be a cyclic nature. But for most refugees, permanent relocation is not available at this time. Many refugees have lived in refugee camps for years. They could be sent back to their countries at any time or sent to other refugee camps. This could lead to continued lack of stability or a home and be cyclic in nature. The U.S. President determines the number of refugees allowed in the United States. President Trump allowed 15,000 refugees for the year 2021. This is the lowest it has been since the Refugee Act was enacted in 1980. It takes an average of 2 years for a refugee to apply for relocation until they arrive in the United States. Refugees can then legally work and become U.S. citizens. Barriers that refugees might face are cultural differences or cultural shock, discrimination and prejudices from the community they now call home. Many refugees have a different religion than the majority of those in the United States, and there might not be a place of worship near them. And of course, language barriers. Refugees are fleeing their country due to being persecuted or unwelcome. Refugees can also experience bias or prejudices when relocated to their new home. Social economics that can affect the health of refugees are inadequate income to provide adequate food security, undertreated health conditions or lack of treatment due to being a refugee and leaving their country, communication barriers or language and literacy, as well as being unable to afford health care. These can all be barriers to receiving access to health care. Healthcare disparities based on race, ethnicity, religion, and gender roles can vary greatly due to the fact that refugees come from many different countries with differing religions and gender roles based on their culture. Geographical location can also vary based on where the refugee is relocated. If placed in a rural community, there might be a limited number of healthcare providers, especially ones who speak the language of the refugee. If placed in a city, there would be a greater number of providers, as well as more access to parks or other ways to stay physically active. Telehealth or telemedicine would provide greater access to interpreters or a provider who knows the primary language of the refugee and understands their culture. Implicit bias that can be portrayed as a healthcare provider is being less personable to a refugee patient due to being uncomfortable with them, not knowing what to expect or how to best approach them. Explicit bias that healthcare providers portray are not wanting to provide care for someone who speaks a different language due to the increased time it takes to use an interpreter. There may also be a decrease in adequate patient education due to the cultural and language barriers that it takes the additional time to address. Some explicit barriers can be a result of the recent war on terror, and we are now seeing people from these countries that are refugees. Health disparities internationally wouldn't be a problem if refugees simply weren't refugees. If the people were able to stay in their countries, be safe and free from persecution in their homes, they would have access to care that is provided in their same language and with providers who understand their cultures. These are the references I used for my presentation. Thank you.